Hello, and thank you for letting me or giving me the opportunity to talk to you today. Sorry I can't be with you in person, but I'm hoping we can still have a good discussion here. Um, I was asked to talk about ways to keep does and ewes healthy going into the lambing and kidding season. And if you've listened to my presentations before, you're probably going to see some common themes here, but we're going to go through some of these things. And the goal for today is to get you to think bigger a little bit about how to be preventative rather than responsive. So we're going to go through today and talk about several things. We're going to go through, excuse me, a little bit of a cold. We're going to go through each of the three periods around parturition. So we're going to talk about the prepartum period and some things that can go wrong. We're going to talk about some potential solutions and some preventative measures for those types of problems. We're also going to talk about things that can happen during parturition and some things in the postpartum period. So we'll get started with that. I think one of the first things I want to convey to the group is that there's a little bit of philosophy that we need to discuss. I think we often focus more on disease prevention and less on health promotion, and it might be just words, but I think it's important to consider what words mean sometimes. When I think about disease prevention, I think we tend to focus on preparing animals for diseases. I think we focus on the diseases, we focus on what we can give them to keep them healthy. And in my experience has been that a lot of times this focuses us on things that we can deliver through a needle. I would challenge you to think instead about health promotion. How do we get our animals to be resilient, productive animals in the face of sometimes adverse conditions? And I think this shifts the focus from what I can give to my animals to what I can do for my animals to keep them healthy. So we shift from solutions through a needle to animal husbandry. So kind of bear that in mind as we go along today. I know you guys are getting a lot of presentations today on nutrition. I think they're coming after my presentation, and I can't stress enough that you maybe can take a little break, go get a cup of coffee for the rest of mine, but definitely be there for the presentations on ewe and doe nutrition. I think these are really important things, and as a veterinarian, it might pain me a little bit, but I'll just say it that I think nutrition is way more important to keep animals healthy, probably than just about anything else. I'm not going to focus on the details here because you're going to get a lot better information from the experts later. But I just want to point out that low body condition score, low energy reserves in those animals is a leading risk factor for almost all the diseases that we face in livestock production, including sheep and goats. I think that animals that are in good body condition, they have adequate nutrition in the form of energy and protein, and they have adequate minerals and vitamins, are much more resilient to disease. They're so much less likely to develop issues going forward. So just bear that in mind. If you take nothing else away from today, make sure you really pay attention to nutrition. And one of the most common diseases that we'll talk about first is actually pregnancy toxemia. This is a direct result of not managing nutrition for pregnant ewes and does very well. The interesting thing about preg tox or pregnancy toxemia is that it's actually mismanagement in both directions. So if you get does or ewes too fat early in gestation, especially, or they're too thin, they're more susceptible to pregnancy toxemia. And ewes and does that are carrying multiples also are at much higher risk because of the increased energy demands. Basically, pregnancy toxemia is just the result of an inability of a ewe or doe to eat enough each day to meet her energy demands, and she starts mobilizing fat. Whether if she's fat, it's like overweight, it's readily available, or if she's thin, she catabolizes what little she's got left. And ruminants' livers can only take so much fat metabolism at a time, and they end up filling their fat full of liver that can't be processed quickly enough, and that just compounds on itself, and pretty soon you have very sick animals. This is one of those diseases you totally have to prevent. My experience with treating preg toxins is, well, you can often save animals very very seldom, and unfortunately, few amount of times do we get to have the best outcome, right? We get live kids or lambs and a live doe. A lot of times we end up having to do some picking and choosing. So making sure those animals are in adequate body condition going into parturition is very, very important. You can treat it. A lot of times diet changes, increasing dietary energy can help, although that needs to be done with some care to prevent other problems. You can use glucose therapy. A lot of times the best way is just to induce parturition, and unfortunately, sheep and goats aren't very tolerant of having their young early. If they're more than about 5 days early, most of those offspring won't survive. So it can be pretty bad in terms of outcomes associated with inducing animals early. So prevention really is a key thing. Another thing that people often don't realize that goes with pregnancy toxemia is that sheep and goats are really likely to develop hypocalcemia in conjunction with pregnancy toxemia. And this is a little bit more insidious. It's not quite as easy to see. And a lot of times you see things that don't necessarily add up. And the most difficult cases to treat are pregnancy toxemias that have hypocalcemia that's superimposed on that preg tox. A lot of times you may not see very much. They might not do very well. Sometimes you can see bloat or low body temperatures, or if it's hot, you'll actually see them get warmer. They actually can't control their body temperature. Has to be treated with calcium. Prevention again is key. Making sure that animals that have preg tox get some calcium as a standard practice, but preventing this by feeding high calcium feeds late in gestation. A good example of this is alfalfa. It's really high in calcium. I'm sure the nutritionist will cover this in some more detail as well. One thing that's really frustrating about sheep and goats is they have a lot of things that will cause abortions and stillbirths. There's many bacteria. I've got quite a list here: Chlamydophila, Coxiella, Campylobacter, Listeria, Lepto. Toxoplasmosis is actually a parasite. We talk about a lot of viruses, and these things are frustrating. Sheep and goats don't have a lot of tools like cattle do. We don't have a lot of vaccines, not a lot of research in many cases that's been done that help us understand and prevent these things. So I think prevention again, and prevention in the form of biosecurity is really important. I'll give a couple examples here as we go along. Excuse me. I think one of the first things when you find yourself in a situation where you're having an abortion or two is, one of the first questions I often get is how do we know when it's time to start responding? When do we get excited? And it's really hard to answer that question. I often tell people, the first one we might take is just a bit of bad luck or just something, maybe we pay a little bit closer attention. The second one, we're starting to get concerned. We want to make sure we've got a plan in place about how we're going to respond. And by the third one, especially if you're in a smaller flock, it's time to get going and figure out what's going on. I never would discourage anyone from just pursuing these as a matter of standard practice, because you can learn a lot about what's going on in your herd by doing some of this diagnostics, but it is expensive and sometimes doesn't seem to pay off very well. The first and most important thing I think is to record, keep some records, be able to know when things are happening. If you notice animals are aborting, write it down, record when it's happening, try to take some notes about the animal. As a veterinarian, it really helps as we go back and look at the history of these things as they unfold, if we have some of those details. And then make sure that if you're collecting things or even noting what kind of condition the fetus is in, because that can tell us a lot about what's causing the problems. That includes placenta too. If you're collecting tissues for diagnostics, it's important to get them as fresh as possible. Make sure they don't get frozen. Always get the fetus and placenta. Placenta is so important. For instance, you can't diagnose toxoplasmosis very effectively without having placenta, even though it's one of the most common causes of abortion in sheep and goats. So getting that placenta, if you're going to do some diagnostics will sure be more rewarding. And always be mindful of the fact that these can be pretty unrewarding. In cattle, we expected no more than 50% success in any particular case. So every time I turn an abortion case in, got a 50-50 chance in cattle. It's probably less in small ruminants. The key is persistence. So if I have 50% this chance this time and a 50% chance next time, I can work my way toward an answer with a little bit of persistence. Another thing that I think is really important when you do diagnostics is remember that even if you get a negative answer, that's information. So you can know something about what you don't have. And that's also important as you develop some plans to contend with these problems. I'm going to skip ahead one slide here. Talking a little bit about abortion and biosecurity. I think there's two ways you can look at this. One of them is bioexclusion, the other one is biocontainment. So I define these things as bioexclusion is keeping the bad things that we don't have out, and containment is keeping the things that we do have from getting into the animals that are most at risk. So bioexclusion, for instance, is if I don't have CAE or OPP or something like that and I'd like to keep it out, I'm going to do some testing when I bring new animals in and make sure that I don't bring it in. There's some good general guidelines, especially around this time of year. There's often temptation. Sometimes my own family succumbs to these. You get the opportunity to buy a couple bottle kids or something like that. But I think adding new animals into a flock or herd during late gestation or early lactation for the herd is really high risk. If there's any way to avoid things like that, essentially what happens is that one part of the herd, whether it's the resident flocker herd or the ones that get brought in, are probably not in the same place in terms of what they're carrying as the other group. So one of them essentially infects the other one, and it's almost a sure way to get into some trouble. Locking down that herd, even if it's just for a couple months before lambing or kidding, can be a very valuable way to make sure you don't get into trouble. There's always some direct things too. We know cats will shed toxoplasmosis, especially kittens. So if you don't want to have to contend with those types of abortion, then it's best not to have cats. If you want cats, you can actually contain it by making sure you don't have kittens. So if you spay and neuter adult cats, you'll create a stable population. And those cats, those adults, shed a lot less toxo into the environment and will cause fewer abortions than kittens will. It's also important, if you do have abortion cases, to get rid of the placentas and the fetuses one way or another to get them away from the herd. Usually those are one of the highest sources of new infections. It's one of the most rich sources of bacteria and viruses in some cases, and you want to get rid of those things, get them out of the environment. Same thing is true after a ewe or a doe is aborted. Many times they're shedding the pathogens and they can shed to other animals, and it's very valuable to get those animals separated away and get them out of the flock so they don't get other animals in trouble. Going back to this one, Cache Valley fever virus I heard quite a bit about this last fall. Maybe some of you have experienced it. Causes these fetal malformations. You'll see arthrogryposis, which is the twisted up, kind of frozen in place legs. You'll see nervous system and head deformations. It's very frustrating because you can have difficulty getting lambs out. They're almost never viable. And controlling this one, there is no vaccine. It's actually an RNA virus, so it's really difficult to make a vaccine for this one. It's transmitted by mosquitoes, which we try to control mosquitoes for humans. We want to control things like West Nile, other things, and we know that mosquitoes are really difficult to contain. We either have to use a lot of pesticides or kind of tolerate their existence. So if you were in a situation where you didn't want to have or deal with Cache Valley, you can leverage the way the vaccine or the way the virus works to make sure you don't have it. And the key feature here is that ewes can only get infected and the virus can only cause these malformations if they're if the ewe is infected before 45 days of gestation. So if you wait to start breeding until after the mosquito season is over, you're just not going to have cache valley fever virus affected lambs. And once, if they do happen to get infected after 45 days, the lamb will be born normally. So most of the reports I heard were lambs that were born or conceived during August and September, which is still kind of prime mosquito season. I think this is a good example of how, even if we don't have any tools, there's still things that we can do if we really want to avoid the problem, right? We could just avoid breeding early, breed a little bit later, and we could get out of this problem if it was significant in our operation. I talked a little bit about vaccines before. Some people really like to use vaccines as an option to control these diseases. There are a couple of vaccines. There's one for chlamydia. There's also one for Campylobacter, so enzootic abortion, vibriosis. Excuse me. You don't want to use these things during pregnancy because they can actually abort fetuses. They're kind of rough vaccine. And I would really encourage you to think about other ways to prevent these diseases. Vaccination for these doesn't have a lot of data to support it. It may be valuable, but I would never bank on it. I would use this as an insurance plan. I wouldn't bet that it's going to create really good immunity. So don't think that you can just vaccinate and forget about some of these things, because they'll keep coming back. We can use antibiotics to stop some of the bacterial causes of abortion. For instance, Chlamydophila, which is enzootic abortion, and vibriosis, which is Campylobacter. You can use injections, although most people prefer to feed it. It is actually legal to feed chlortetracycline or CTC to sheep for the purposes of controlling these types of infections. However, one of the important things to remember is that it is a VFD drug, so you have to get a written veterinary feed directive prescription from a veterinarian, and they cannot write those things off-label. So they're going to be able to write it for 80 milligrams per head per day. And the research we have shows that it probably takes 300 milligrams per head per day to prevent abortions, which we can't do legally. So this may not be the best option. It might be more work to use injections, but if you're in an outbreak, it's probably more valuable to go ahead with the injections than the feed grade stuff. You can also feed lots of other things that can help, although they don't necessarily deal directly with the abortion issue. Feeding Rumensin to goats and osalacid can help with coccidia, which in a lot of cases will help maintain some of those some of that condition, help them maintain energy balance through pregnancy, even though it's being fed for coccidia more so than the feed conversion part. And also in sheep, osalacid or Bovatec has been associated with decreased toxoplasmosis abortion, although you cannot feed it expressly to do that. So there's some advantages to feeding some of these other products. Now this again, veterinary feed directive. So most of you are probably familiar with this by now. You have to, almost all antibiotics except for the ionophores have to be covered by a veterinary feed directive in order to be used by livestock producers. So it's basically a written prescription for how the feed is going to be made and fed. Records need to be kept both by the veterinarian and the producer about how the feed is fed to the animals. And there's a couple things in there, but I think one of the most important things to remember as you interact with veterinarians in this area is that we cannot prescribe extra label use. So if it doesn't say 300 milligrams of CTC per head per day, we cannot write it on the VFD. So it's impossible to do that. It's probably better not to even ask. Just a couple things to finish up here. Once you get them to parturition, I've always been amazed by how most sheep and goats can pretty much get through parturition without a whole lot of trouble. You get some of the twisted up twins and the dystocias and stuff, but generally it's amazing that they can have so many multiples without very much trouble. Ringworm is one of the things you'll see. This is a failure of the cervix to dilate during parturition. Sometimes you can manually dilate these, but remember this is a hereditary condition. If they do it once, they're probably going to do it again, and their offspring might do it as well. These are good ones. If they're successful, probably good calls and good to just sell their lambs or kids. Stocia, large offspring is probably the most difficult one of these. C-sections are possible, but often very unrewarding and very expensive given the price of sheep and goats. So they don't happen a lot. A couple things about lambs and kids. This is mainly a talk about the adults, but you're going to get some demonstrations later today. I think there's a couple of people that are going to talk about how they manage kids and lambs. Young sheep and goats are really, really good at being radiators. They have a lot of surface area compared to the amount of weight they have. They can lose a couple, 2 to 4 degrees in the first 15 minutes after birth. And that probably is accelerated even more in conditions like we've been having lately. Having the ewe or the doe clean them off will remove those fluids, and it slows that cooling effect. But just bear in mind when things are as cold as it has been and seems to continue to be, that we will struggle with hypothermic animals, and it's really important to make sure that at least until they're they're dry, that they're adequately warm. Colostrum is a huge thing. It's probably the single most important event that happens in a ruminant's life. They get the essential antibodies they need to protect themselves for the first few weeks to months of their life. They don't get any across the placenta, so this is their one chance to get some immunity. It also provides tremendous amounts of energy and protein to the newborn. Probably good to get lambs to nurse within 30 minutes and intervene if they haven't done it in 2 hours. But if it's as cold as it's been, it's probably good to intervene more quickly, especially if they seem to be slowing down. As a vet, we always get caught by the extra lamb or kid, and always make sure that everything is done. And then always bear in mind that pregnancy toxemia and hypocalcemia, while most common before lambing and kidding, can happen afterwards. If you have any questions, you're welcome to get a hold of me. My cell phone number is listed there along with my office number and my email. Please don't hesitate to call. I hope this has been an enjoyable presentation, and if you have questions, please contact me. Calls, texts, emails, whatever. I try to get back to everybody. So thank you, and have a wonderful afternoon out on the farms today. And like I said, pay attention to nutrition people. They've got a lot of good stuff to say. Thanks a lot.